This is episode 25 of the Women in Depth podcast. The information found in this podcast is not a substitute for help from a licensed mental health professional. Today's topic is one that many women can relate to, and that is the experience of having a traumatic childbirth, also called birth trauma. According to statistics, 30% of women fall into the continuum of experiencing a traumatic childbirth. In actuality, this number is much higher, as it does not take into account women who did not report this experience, or women who do not realize that they even experienced a traumatic childbirth, and so are unable to indicate whether they experienced one or not. In today's episode, Krysta Dancy is going to take us deeper into the topic of childbirth trauma, explaining exactly what it is, how it can be experienced, how birth trauma differs from other traumas, why birth trauma is somewhat controversial and uncomfortable for people to acknowledge or talk about. What are some predictors that a woman may be vulnerable to experiencing birth trauma? And then immediately after birth, in the birth room, what are the signs that a woman has experienced birth trauma? And much later, months or even years into motherhood, how this traumatic childbirth experience can show up. So without any further ado, let's go ahead and get started with the interview. Hi, and welcome back to the podcast. Today, our guest is Krysta Dancy. Krysta is a licensed marriage and family therapist in Roseville, California, where she has been working with clients since 2005. In addition to her private practice, Krysta is the co-director and a clinical supervisor of the Place Within Counseling Center, a nonprofit that offers counseling on a sliding fee scale. Krysta is passionate about partnering an attachment-informed therapeutic style with neurologically informed interventions such as EMDR and brain spotting. She talks about both in her blog, www.confessionsofatherapist.com, where she enjoys writing as a creative outlet. In her ongoing passion to support women, Krysta became a certified birth doula, a non-medical birth support person, and is also currently undertaking research on the topic of birth trauma. Krysta also serves on a local Sutter Hospital perinatal mental health task force. And when not in the office, Krysta can be found with her husband and 2 young sons, or out enjoying her favorite de-stressor, hiking in the beautiful foothills of Northern California. Hi, Krysta, and welcome to the podcast.
Hello, thank you for having me.
I've really been looking forward to our conversation, excited about this topic because birth trauma is just not something that there's a lot of information on, or at least none that I've found. And I know that this is an experience that unfortunately many women experience.
Yes, you're absolutely right. I think it's surprising to me how little information there is on the subject. My experience has been that it is quite prevalent, and I suspect might even be increasing in frequency. So,
yeah, and that would make sense, especially since it's not talked about, you know.
Mm-hmm. Yeah, we both know as therapists that tends to be the case. The things that happen quietly are often the ones that continue to go unchecked.
Krysta, can you share a little bit more about yourself with our listeners? I know I read your bio, but is there anything else you'd like to add to that?
Sure. Yeah. I think probably through the bio is pretty clear. One, I think like a lot of therapists, we find our passion or our niche through what sort of finds us in the office. I've been in private practice, and working with clients since 2005. So during that time, I started out and wasn't a mom, but over time, had my own children. And it was interesting how other young moms ended up finding their way to my practice. And so just through experience, started finding more and more kind of fertility related issues, including infertility and infant loss, postpartum issues, and that kind of thing. So became passionate both through my own experiences as a mom and with my really cherished friendships, and then also through my really well-loved clients. Find myself, even now as my kids age, I'm still in this area of birth and fertility related issues for women because it is, to me, it feels so formative.
Yeah. And it definitely is, an experience that I think that it's something you can begin to connect with once you actually go on that journey of being a mom.
Mm-hmm.
The whole process of pregnancy and, just the natural unfolding of that is something really that as a woman, it's so primal and so deep. And it just seems that a lot of times what is talked about is just the kind of like the white picket version of,
Mm-hmm.
of pregnancy and birth. It almost becomes like taboo, or you feel like, what's wrong with me that this is how I'm feeling or thinking about something that, you kind of see in the world as through a rose-colored lens.
Absolutely. You took the words right out of my mouth.
Okay.
Part of the reason I'm passionate about, speaking about this when I have the opportunity and researching it is because it doesn't make it into the script that we hand moms. There's this Pinterest version of motherhood, and
I love it.
This doesn't match up with that at all. And often, one of the things we might talk about more deeply, but what I find with a lot of my clients, unlike other traumas, for instance, if we endure a car accident or, a different kind of medical trauma, we are usually given a great deal of empathy and a lot of leeway for whatever reaction we have. But when it comes to birth trauma, women in my office frequently tell me that they're really shamed, that they're often, the response they most likely get is, well, you just should be grateful you and your baby are healthy.
Yeah.
Or one of the things that just they hate hearing, and I hate hearing, is the phrase, a healthy baby is all that matters.
Yeah.
Because the insinuation then is that you're not grateful enough.
Yes.
And when you compound trauma with a feeling of shame, you can see how that's a recipe for a lot of pain.
Yeah, and just a lot of isolation, because I think, one of the saddest parts about this is a woman who's experiencing this oftentimes can't turn to other women, because those women unknowingly, some of the time, are actually part of the painful experience.
Mm-hmm. Yeah, absolutely. I agree. I think, and this is a whole other topic for a different podcast.
Right, it is.
There's been a lot of polarizing around the issue of birth itself. And anytime we see polarities being created, you've got like the natural birth moms, and you've got the elective cesarean moms, and you've got like this polarizing happening, which really just harms women, in my opinion. And I feel like I have to even go out of my way to say I don't really have a buy-in that there's a right way to have a baby.
Yeah.
I have a buy-in that what I care about is that the moms that I serve feel informed, they feel respected, that they feel like they get to be active participants in what's happening to their body. That's my buy-in. But the fact that I have to say that is even a sad commentary, because there's such a polarizing happening that when women experience a traumatic birth, they don't even feel like they can talk about it often with their closest friends, because there's this fear of implied judgment.
Yeah, and I think you're beginning to lead into my next question of, why is the topic of birth trauma important? Why does it matter?
Mm-hmm. Yeah, so I think it matters for the things we just spoke on, which is the isolation piece. We don't have a lot of good research around the outcomes of birth trauma, and I can get more deeply into that if you'd like, but we do have good research around trauma itself. And what we know in the long-term effects of trauma is that any sort of trauma preceding a birth leads to complications like failure to thrive in an infant, postpartum medical complications, or postpartum mood disorders. It's very disruptive to the mother-infant bond, which we know is attachment. And then I often see with women in my office, there's a damage to the relationships with their partners, who either feel confused or feel blamed, or, don't understand what's happening. And so why it matters, there's this beautiful sacred space around when a mom goes from a woman to a mom. You don't ever get to go backwards. And that threshold is very formative. My opinion is it's formative. It's almost a rebirth for the woman herself.
Yeah.
And so if that is done in a way that feels scary or damaging or disrespectful or violating, that matters. That creates a chain effect in the way that they bond with their child, and also how they feel about their own bodies.
Yeah, there's such this experience is so profound because of all the layers to it. And like you described, there are so many ways that a person's life, her relationship with her child, that child's future, her relationship with her partner, her relationship with herself. I mean, all of this is rolled into one complex space of everything that happens at this time and going far, far, far into the future. I mean, this is just, you don't realize how important this space is, this very sacred space. I like how you described it as a threshold.
Mm-hmm. Yeah, but it's one that doesn't, like I said before, you don't get to go backwards. You don't get a do-over. And, whether we like it or not, whether we want it to be the case or not, often the pathway that we took into motherhood becomes a narrative that we remember very clearly the rest of our lives. And so to me, I've seen amazing things happen in my office, and that's the hopeful piece. Once birth trauma is identified and it receives appropriate treatment, I see just a reformation happen within the woman and her relationship to herself, her body, and her child, and sometimes her significant others. So it can be changed, but it can't be redone. Yeah. And that's why I think it matters.
Right. And if it's not changed, that is where the damage is really significant. Mm-hmm. Krysta, can you just maybe share with us what is birth trauma?
Yeah, very good question. So let me back up even one step further than that question and talk about what is trauma for a second. Yeah. In a normal memory or normal experience, you have a vivid experience. Let's say you had a delicious dinner. You remember all of the details in salient, precise details for a short time. And then within a short window of time, it becomes factual. So maybe a few hours after the dinner, you can still really savor all the smells and all the tastes. But by the next morning, it's a little bit faded. And by a week later, you might be hard pressed to remember where you went for dinner that night. But maybe if somebody prompted you, you could say, oh yeah, I had that dinner. But it becomes a factual memory. And that's how our brain is meant to process our experiences. What happens, for a variety of reasons I won't get into because they're sort of nerdy. Not everyone does. But in a trauma situation, you have a vivid, disturbing experience. And because of what happens in the nature of trauma, your brain does not process it that way. It can't send it through the same channels and turn it into factual memory. So what it ends up doing is almost creating, the way I visualize it is I like to think of it as like a walled off or a bubble. It's almost like this abscess of experience where it can't process it correctly. So your brain just tucks it away and says, nope, don't know what to do with that. And you move on and you experience new things and form new memories and you grow and you learn and you change and you evolve as a human. But then what we call a trigger is when something occurs that, especially somatically, which means in the body, somatically brings you back to the trauma experience. And suddenly that wall has burst open. And you may not even know. Sometimes it's a full-blown flashback. That's in a severe instance. But sometimes it's not a flashback. It could be just simply a somatic expression. So that could be elevated heart rate, or you're breathing really hard and rapidly. You feel dizzy. You feel angry. You feel fearful. You feel anxious. The list goes on. But you basically start to have this, the way I like to explain it to clients is it's almost like time travel. Like your body is suddenly back in that traumatic moment. Mm-hmm. So birth trauma is just simply, my way of shortcutting and saying somebody left their birth experience and has trauma symptoms like I'm describing. They have clinically significant trauma symptoms.
So what could be an example of a birth trauma?
That's a really good question. So this is where I'm going to depart a little bit, and I want to make sure to clarify this. So, our diagnostic manual for psychology has a diagnosis for post-traumatic stress disorder. What we find is that about 5% of women after birth meet the criteria for PTSD. But if we loosen the criteria a little bit, if we loosen it up, to just be clinically significant trauma symptoms. So not fully diagnosable, they're not hitting all 4 criteria, but they have clinically significant enough to cause impaired functioning in some way, whether infant bonding or sleeping or something to that effect. Then, I don't know if you can believe this, but we have seen over 30% of women have some form of clinically relevant trauma symptoms. So to your question, what does this look like? It is a large spectrum, because you can have everything from a woman who had a sort of classic PTSD experience where she or her infant were at risk of death. And because, as we know, that can happen with highly complicated deliveries, things like hemorrhage, or the baby is born non-responsive, or, any variety of those things that are sort of classic PTSD examples. But what I think is most surprising to people is that there's a large percentage, I would even venture a guess that it might be more than half, that had on paper a medically normal birth. And so then we start to look at, what does birth trauma really look like in those cases, and what's going on. And that's where I think I really like, there's a particular research paper done by Creedy, Shawshall, and Horsfall, if I'm pronouncing that correctly, where they said that the best predictor of a woman ending up with birth trauma symptoms was 2 things: the level of obstetric intervention and the perception of their care. So that's where it gets a little bit, do you see where I'm saying, where it gets a little bit gray? Because you can't just say, it's very clear with women who have life or death deliveries, that PTSD is sort of an expected outcome. But then there's this large gray area where perhaps the medical personnel around her didn't really feel anything was necessarily extreme or alarming, but she still has clinically relevant trauma symptoms after the fact.
Right. So it's really, a lot of it is the woman's perception of her birth experience too.
That's almost right. Universally. That, along with the level of medical intervention they receive, are the 2 biggest predictors.
So I can see how but just by loosening the descriptors for trauma, you really give permission to many experiences that women have, but perhaps have not been given really a lot of attention or weight.
Yeah, that is my feeling in my practice. If I had the research dollars, maybe one day, I suspect that a lot of postpartum mood and anxiety disorders that we see could potentially be undiagnosed trauma. And why that is relevant is because trauma is incredibly treatable with the right tools, whereas mood and anxiety disorders have a different treatment approach. And so if you're not being correctly identified, you're not getting the right match in your treatment. And so that's where I'm passionate about increasing awareness around this.
Yeah, because you can see how, because depression and anxiety are part of the trauma symptoms, a woman could be diagnosed with one or both, even given medication, but it's not treating the actual concern.
Exactly. Yeah. And so, an example, just one little example of this is, one of the diagnostic criteria for trauma is hyperarousal, which is a fancy way of saying that you're just really sort of frenetic and on edge. And it's kind of anxiety, in my opinion. It's anxiety wearing a fancy coat. And so what can happen is, and the literature says that arousal is one of the most common symptoms of birth trauma. So a woman comes into the office and says, I can't sleep, I'm on edge, I'm afraid something's happening to my child, I'm constantly imagining the worst case scenario. And her physician understandably will diagnose her with postpartum anxiety. However, a few careful questions might reveal that what she's actually exhibiting is hypervigilance, and it's the result of trauma. And that is a totally different treatment branch. Yeah. So that's where I think that there's so much great education that can happen just to validate women's experiences and get them the help they need faster, because trauma is actually incredibly treatable.
Yeah. And I can see how, when you don't have the information, which, you said this at the beginning, that you really felt that, part of your role in this is to help the women you work with, and women in general, be informed about what is going on. And really, this information, a context to make sense of their feelings, their experiences, can really help to shift just, feelings of shame, blame, isolation, all these areas that it can bleed into when you can have a context for understanding what is going on with you.
Mm-hmm. Absolutely. It's, so you and I both know that so much of what, we see in our office is exacerbated by isolation.
Yes.
We don't have the tribe. And if there's ever a time in the lifespan when the tribe is so needed, in my opinion, it is as a woman becomes a mother. And it's so lacking in modern society. So there's just not that space to tell your story.
Yeah.
And be heard and be connected. And I really believe women are suffering because of that lack.
Yes, and I think, with going along with being able to tell the story, there is an unsaid message, I believe, in our society where there are some stories that are okay to be told and some that aren't. And one of those themes, I would say, or those narratives, is the narrative of my childbirth experience was not good.
Right.
My childbirth experience was painful. Because like you said earlier, then you go into, well, at least you have a healthy baby. Don't be so selfish. All of that.
Mm-hmm.
Yeah.
Well, and because women can't help but compare, right? So if your childbirth experience comparatively was less complicated than mine, and you're unhappy with it, or if your childbirth experience was identical to mine, and you are not okay and you're not at peace with it, then I'm going to infer that means there's some judgment about my own. So it becomes really complex.
Yeah, it does.
In the interpersonal dynamics. So women find themselves even isolated from their best friends, isolated from their own mothers around this issue.
Right. There's like a birth complex in general, just,
yes.
Right?
Yes,
and then
right.
it turns into a motherhood complex, I think.
Yes. Oh, yes. That's what I'm saying. That's a whole other podcast around mothering and the ways that we have set women up to constantly feel like they're failing one way or another, so that they sit in judgment on one another. All it does is it's just to our own detriment. It starts with birth and it goes on from there.
So, Krysta, what are some of the maybe experiences of childbirth trauma that maybe are a little bit more innocuous or hard to see?
Yeah, so, we have, like I said, on one end of the spectrum, we have those that are really clear that there was a risk to life and limb. And then on the other end of the spectrum, where it sort of looks innocuous in the room, I've seen some real harm done to women who have medically normal births around just sort of the way their bodies are handled. So, for instance, having things like membrane stripping, or their membranes ruptured, or a cervical exam without giving permission in the middle of a contraction. Mm-hmm. And when you start put together, unfortunately, as a birth doula, I can tell you that's considered very normal. And so it wouldn't raise the alarm bells of anybody else in the room.
Yeah.
But the felt experience of the woman in her body is that she feels violated. She feels like she wasn't a decision maker in what was happening to her. And what can sometimes, or even frequently, happen is that those sorts of what's considered a minimal intervention that unfortunately some medical providers don't even get informed consent around, they can end up leading to a cascade of other complications. So an example might be, I'm just going to strip your membranes without asking, or I'm just going to break your water without asking. Well, the broken water now leaves room for infection. Infection leaves elevated temperature, leads to strain on her body, leads to an emergency C-section with baby not responding, leads to a chorio or an infection in the uterus. Now we're in a hospital stay. You can see how the cascade happened. So, for her and for her medical team, they might not even document any of that as alarming. It might just be sort of what happens, and aren't we glad that everything worked out? But for the woman, when she starts to replay the narrative, because the narrative is so important, and she rewinds it to that moment, and that moment becomes unknowingly the tipping point, then that starts to become a really easy trigger for her. Does that make sense?
Yeah, it does. And I was also thinking too that when these things are just kind of happening as kind of standard operating procedure, and there's not that consent or even that discussion about what is happening, I can see how the woman, in addition to feeling violated, feeling out of control, can also feel responsible in a way. Like, I didn't say anything. I should have been an advocate for my child and myself. Just that part of it also coming into
sense
play.
of guilt.
Yeah.
Yes, you're so right. And as you know, trauma can sometimes have that idea of guilt around it, and that makes it even feel worse.
Yeah.
It's not always realistic or accurate, but that doesn't matter. It still feels true.
Yeah.
And that is one of the things that I think is fascinating. Again, like one day when I have $1 million to research this, women in childbirth, any woman who's given birth knows that it consumes all of your senses. You are not in a space to weigh out pros and cons and be in an adversarial conversation and ask hard questions. You're just not. Your whole body and your brain are consumed with this process that's happening, the cascade of hormones going through your body. And so what I think is important to get across is that it is more typical than not, in my experience, that women who go on to feel birth trauma were rather silent during their birth process. And that ends up playing into why they feel so badly about it afterwards. And I like to remind them that they're silent by virtue of what was happening in their body and that is normal. But like you so carefully pointed out, that also contributes to them feeling a sense of, I wish I had said, I wish I had done.
Right. And I think, also what sets this up too is, how they tell you to have a birth plan, And so I don't know, I haven't done a study, but from what I can tell, birth plans kind of are almost just like an idea or, exactly that, a plan. And I think for a woman going into this, especially, I guess it's for all moms, but I think especially for first-time moms, there's a sense of, what happened to my plan, especially if the plan doesn't even come close to what she thought it would be.
Right. Yeah. As a birth doula, I think there's a lot of value to women thinking through their options when they are not in labor, and that's the purpose of the birth plan is let's think through the pros and cons of what you want, but when you're not overwhelmed by the birth process. So you're not making these decisions, in a pinch. You're making these decisions when you're thinking and you're weighing pros and cons and not in the moment when you're overwhelmed, often in a lot of pain. So I think that the birth plan is really important. And there's a little bit of research to suggest that the birth plan itself, for instance, if you look at women who have kind of preparatory anxiety about birth, they've controlled for that and shown that actually doesn't have a correlation with higher incidence of birth trauma.
Okay. I
have seen some interesting research to suggest that birth plans may alter how women are treated in birth, but I don't know. Yeah, I don't know. That hasn't been conclusive. I think, that's interesting. That caught my ear.
So, Krysta, what are some of the common ways that birth trauma shows up in a woman's life post-birth? So this is the woman who is, dealing with motherhood, going about her life, maybe even going back to work. How does it start to kind of sneak into her day-to-day?
Yeah. So in the delivery room, if we rewind to the delivery room, there's some work done by Beck, who I'm a big fan of her work on the subject. And she says in the room, there are three things that you'll notice that sort of lend themselves to a higher likelihood. One of them is a woman who has a dazed appearance just after giving birth. Another one is symptoms of withdrawal. So just sort of an emotional withdrawing from either their infant, their caregivers. Another one is temporary amnesia or confusion. Okay. So when you see those in the birth room, and I'm always looking for that as a doula, and that's good for anybody to know who's in that field. When you see those three things in the birth room, that means there's a high possibility that her brain has gone into that state that I didn't get into because it's too nerdy, but that the traumatized state. In my experience, especially the dazed appearance.
Okay.
What it looks like in a woman's life postpartum, though, and this is, I think, interesting, the less well-known symptoms, sometimes it can look like difficulty healing. There's a high correlation between birth trauma and difficulty healing from things like episiotomy or breast abscess or an infection. There's a high correlation between this, as I suggested before, and postpartum depression. I believe there's a high correlation between this and postpartum anxiety. And so what that ends up looking like, let me give you a few examples. Women who find themselves replaying aspects of their birth, whether they want to or not, in their mind. It's almost like you hit play on a button and you have to see it through. You can't change your track of mind. Another one would be, as we talked about before, sort of hyperarousal or hypervigilance, where there's just a lot of worry, a lot of excessive fear. Sometimes it shows up as a sleep disorder where, they say sleep when the baby sleeps, but she cannot.
Yeah. So those are really helpful to help someone maybe who isn't really thinking along the realms of birth trauma to notice these and say, what's going on with that? Mm-hmm. So to better support the mom who's experiencing these things.
Mm-hmm. I think one other thing that it doesn't get talked about, and this is me going anecdotally on my own experience in the office, as women are taken off pelvic rest and allowed to resume sexual contact after they've healed, I sometimes see it show up there, where, that sort of sexual contact can bring back feelings of fear, anxiety, pain response, violation. And everyone thinks, oh, sure, women who just had a baby don't want to have sex, but it isn't that. It isn't a lack of desire or arousal necessarily. It's more of a feeling, of a felt sense in her body of, no, stop, get that away from me. Don't do that. Don't touch me. And again, women are often met with, well, you're a new mom. And it's not recognized that can actually be a sign of a trauma response.
So it's so interesting because, I'm going back to the visual that I really love that visual you gave of the trauma kind of being put into this bubble or this separate space and then something coming along to trigger it. So in this example, it could be the sexual encounter being a trigger. And
yes.
She not being even aware of that. All she knows is that her body is not responding sexually to, and then I can see how that just adds to, again, another layer of what's wrong with me? Why can't my body be responsive? And then the feelings also in the relationship with her partner.
Absolutely. It can, and again, that's why recognition and identification of it is so empowering, because until that moment, until women finally get this identification in my office, many times they are just like you said, what's wrong with me? What's going on here? And when you don't have information and you don't know what's going on, you tend to blame yourself. We all do it.
What are some of the myths or misconceptions that may be held around the area of birth trauma? And I know we've kind of touched on some of this a little bit already, but could you expand on that, Krysta?
I think along polarities, I think one of the things that I hear women assume is that birth trauma is sort of specifically for medical emergencies, and or that if you have a cesarean, then you're going to have a birth trauma. And that's not actually borne out by research or in my office. Cesarean birth and vaginal birth are sort of independent of whether or not a woman has birth trauma. So while there's a little bit of an uptick of correlation, there's a lot more that goes into it than that around surgical birth. And I think that's important to say. Why? Because I've seen women in my office who have birth trauma from cesarean birth. And then there's this assumption, and they, again, feel so isolated when other women go in for elective cesarean, or when other women come out of their cesarean feeling empowered and like it was a really positive experience. So I think it's important to specify that's not what we're talking about here. That's a common myth. Yeah. Another one I think is the picture of the highly anxious mother who sort of wants to control her birth experience and has really rigid expectations, and that she wants it so perfect that it can't possibly measure up. And again, the literature is just not supporting that. So I think those are two common myths.
Krysta, thank you so much for sharing all of this. I mean, my eyes have really been opened. I've learned so much from this, and I know that this is going to resonate with so many listeners because I really do believe that whether a woman has experienced this or not, she knows someone who has, whether she realizes it or not.
Absolutely. Yeah.
And so what are your favorite resources for women who may be dealing with this or struggling with it?
So yes, good question. Unfortunately, there are not good resources. There's some academic work going on about it, but in terms of what's available to women, there's just not enough.
So really, this is an area that needs a lot of attention, needs more dialogue, and really needs more light brought to it.
Yeah, that's my opinion, yes.
Krysta, what's the best way for listeners to get in touch with you?
So you had read my blog where I like to have it as an outlet at the beginning of this. And then directly my own website is counselinginroseville.com. That's another good way. There's a contact form on there that allows people to connect with me.
Krysta, thank you so much for your time and your wisdom. So much valuable information that you shared. And I'm just so grateful that you came onto the podcast and had this conversation.
Oh, thank you for having me. I appreciate the opportunity so much.
All right. Take care.
You too.
I hope you enjoyed today's conversation with Krysta. What stood out for me is how a woman's pathway into motherhood, her childbirth experience, can shape her narrative or story of motherhood for the rest of her life, thereby impacting her experience of motherhood and the attachment between her and her child. What also stood out for me is how the mother's perception of her childbirth, not so much the actual events, but her perception, how that's connected to both the trauma and the wounding and the healing process. For show notes to today's episode, please visit www.lourdesviado.com/women in depth. And if you enjoyed today's episode, please share it with a friend. And if you feel called to do so, I invite you to subscribe on iTunes and leave a review. Thank you so much for listening, and see you next time.